evening, sir.
Good evening, Purushottam, sir.
Good evening, sir. Good evening. Good evening.
Good
Yes,
evening.
Good evening. I am student, sir. Your student.
That's a great honor, sir. Sir, അങ്ങനെ പറഞ്ഞാൽ.
I think Dr. Gopi is also busy. Binukutan from IIT Kerala said, Binukutan. Riaz വന്നിട്ടുണ്ട്. Riaz, please.
Sorry, sir. Sorry for joining late.
It's okay, Riaz. You just started only, please.
Yeah.
You are
Good evening,
traveling
Dr.
length
Riaz.
and breadth of Kerala, Dr. Riaz.
Okay. So, can I speak or? Hello?
Yeah.
Yes, please, please.
Okay.
Waiting for you.
So I actually this Nutrilearn is a very important series from IAP Kerala. Very nicely curated by the IAP nutrition chapter. Because in IAP Kerala we consider nutrition, growth, development as integral integral factors as well as foundation stones in pediatrics. So we are conducting regular updates in nutrition since the beginning of this year. And today we are going to discuss a very important topic, which is peri-conceptional nutrition, actually, because I have actually asked a few of my KFOG friends also to join the session. We are also expecting them to join soon. And we have a very distinguished speaker also in this area, because I have heard Himabindu Madam talking about the first 1,000 days. And every time she speaks about it, we get some new ideas also. So I think this session will be a great one, and it will you all will benefit. And on behalf of IAP Kerala and IAP Nutrition Chapter, I offer our grand welcome as well as gratitude to Himabindu Madam. Over to Priya for continuing the procedure. Welcome,
Thank you,
Jalil Ahmad,
Dr.
sir.
Riaz.
Good evening. Good evening. Namaste all.
Evening, sir.
Madam, good evening.
Good evening.
Yes, good evening.
Thank you, Dr.
Good
Riaz.
evening, sir.
Jalil,
Good evening. Good evening.
Good evening, sir.
yeah.
Hi.
Let me invite Elizabeth, Madam, please. Madam, a few words.
Thank you, Dr. Priya. As Dr. Riaz said, this is a very unique program we have been successfully conducting under the leadership of Dr. Priya, who has taken over as the president of the nutrition chapter. And this time we are really honored to have Dr. Himabindu Singh with us. And she is a very enterprising, very charming IAPN, senior IAPN, who is very passionate about pre-conception care and about the primordial prevention, that is a healthy baby into a healthy environment. And we are so lucky to have you with us on this auspicious day. And we can see a lot of stalwarts. Dr. Singaravelu also has joined. So nice of him to have joined. And Srinivasan sir, after a long time, he is also with us now. Thank you very much for this opportunity, and all my blessings and best wishes for the program.
Thank you very much, Madam. And good evening, Shigaravelu, sir. Now I think we will start the program. Dr. Himabindu Singh as Professor of Pediatrics, Additional DME and Dean of SIMS Telangana. Let me invite Himabindu Madam for her talk. Madam.
Yeah, thank you, Dr. Priya. And I really thank the IAP Kerala and the IAP Kerala chapter, nutrition chapter of Kerala. That's really so wonderful that Kerala always projects nutrition as the important, definitely worth, saying that nutrition is the most important thing for a child development. And we have doyens and authority in nutrition, Dr. Elizabeth Madam from there. I really appreciate Dr. Riaz. I think we need to mute others. We really need to appreciate Riaz, who's the president of Kerala chapter. Dr. Riaz, I know you personally. You are taking lead in such programs, and such wonderful programs we have, under your leadership in Kerala. I'm really thankful for the whole Academy of Pediatrics in Kerala to invite me. Yes, Dr. Pre-conception care is very, very close to my heart, along with the 1,000 days. Thank you for inviting me. Thank you, Dr. Gopi Mohan and Dr. Binukutan, who are the office bearers from Kerala, to invite me. And of course, Dr. Priya Srinivasan and Sajid from the nutrition chapter. And my acknowledgement and salutations to Dr. Elizabeth Madam, Dr. Srinivasan sir, Dr. Johnny Sebastian, and many others who are here on the forum. So coming to, I just like to share my screen. Slide seen?
Yes, madam, it's visible.
Yeah. So this is a very nice topic, Nutri Learn series, which is actually what the topic given to me. It was a theme of the World Health Day, a healthy beginning and hopeful future. I always, think about how we can give the best to the next generation. So my focus on area of research and other to even develop guidelines was how best we can actually guide the prospective parents or the maternal, and how the focus in the first 1,000 days can help to give healthy beginning to the next generation. And it's a hope, definitely hope for the future. So what a lovely theme for on the World Health Day. It was all around the perinatal aspects. So I think it was about prevention of teenage pregnancy, about focusing on maternal nutrition and preconception care. So rightly focused. So we'll just proceed how we as pediatricians can help. Directly. It's not moving.
Double click on the slide and then try to move. Double click on the slide.
Yeah. So to introduce, as every parent dreams their child to be healthy and happy, and pediatricians, we all have a very vital role to empower parents to realize this dream by strengthening the foundation of crucial period from preconception to 2 years of life. So the empowering parents is important to maximize their child's potential. And I would like to add on something new, that is epigenetics. And we all know that how epigenetics, it is actually area of research and many updates have come. So I would like to add something new to already what we know. So the role of nutrition, exercise and stimulation in a nurturing environment during this critical window has a huge impact. So ensuring the best start. So this is what I started in 2018 when I was a state president of Telangana. It was called Mission Lakshya 1,000. So that was I think was the first earliest persons to start this concept of 1,000 days in 2018, later taken up by the Central IP. I was so happy to see the ECT program going on through the country. Now I want to add this Epic 1,000 plus, which is nothing but empowering prospective parents in early child care, and it includes not only preconception, the 1,000 days and beyond. So this is a new area which I'm developing, and so that we combine the knowledge of preconception care along with 1,000 days. So 1,000 days, we all know, we have been talking about this for last 3 to 4 years at least. It's a very important critical window for the child. And research is actually happening, still continuing, how nutrition during this period can influence not just, the organ development of the child, it also has an impact on immune system maturation and establishing the gut microbiome with implications for chronic disease and risk factors later in life. So this is something, with parents, we never thought about all this before. We just thought growth and development. This much weight should be there and the development milestones. That is what we were focusing throughout as pediatricians. But just see the nutrition, the power of nutrition is also on the immune system, the gut microbiome, and also the future chronic disease risk in later in life. So the developmental origins of health and disease is hypothesizing that, if you investigate how the early nutritional exposure can program the lifelong health trajectories, this is a new area of research. We all know about this 1,000 days. What is 1,000 days, right? And actually, I would like to just highlight this. If you see all the other mammalians around, what human is, how it is different from other mammalians. So for the elephant, it is actually the weight which is the most important. The mother is mostly worried of the weight, and we all know how heavy the elephants are. For the giraffe, it is the height, and for the peacocks, it is the beauty. The feathers of the peacock are, the colors and all that. It is known for its the color. But for the human, the mother should be basically concerned about the brain of the baby. The story of the brain starts in the womb. The structure is made in the womb, but the wiring happens maybe after birth too, and up to 2 years of life, which is very, very crucial. And this will shape you as an adult. So that is the difference. The brain of the humans are the most important organ, and we need to focus and invest on the brain development. And the early nutrition investment can actually improve the health and well-being of generations to come, not this one generation. It is intra-generational. It goes into the next generation too. So this is a compelling investment. All of us, the pediatricians, the gynecologists, and maybe the community medicine, and also the organizations like WHO, UNICEF. Now, all of us are focusing on this 1,000 days, and we should also go beyond 1,000 days at the preconception period also. You can see the benefits we have. If you invest on the first 1,000 days, they are likely to be more healthier. They will earn better. They'll get more grades in school. That means there'll be more. The IQ is better, and the life-threatening child diseases also comes down 10 times less. And we'll be having healthier families in future. So this is a compelling investment, and we have to just focus not just on the growth. We know the growth spurts, and here we need to show all these pictures to the parents. The cognition, the body composition, immune maturation, all these are happening during 1,000 days, and therefore we need to talk about it. Now coming to the epigenetics and genetic genes. So is it all in the genes? We always think, yes, when we look at the child, we say it goes on the papa, on the mama. We talk about the family genes, but we also have a power to modify the epigenetics, and actually epigenetics can modify the genetic expression. So there it is, we can play a role. The environment has much more impact on health in later life than the genes. So genetics actually play only 20% role in the lifelong health. Environmental factors, which includes nutrition and lifestyle, determines the remaining 80% risk of developing chronic diseases or the impact on the later life. The genes, the genetic expression can be modified. So I will start with preconception preparation. So having understood how important nutrition has on the impact on the child's brain and the first 1,000 days, let's start preparing for the first 1,000 days by preparing for the prospective parents even before conception. So let all pregnancies be planned. So this is what we need to tell the young adults. I'm now the chairperson of the Adolescent Health Academy, and I always think, I'm thinking beyond adolescents into young adults. So these young adults, boys and girls, are not even aware about how they can prepare for pregnancy. It happens very accidentally in India. It's not at all planned in most of the times, and they feel shy. They don't even discuss. So I think we should break the myth. Now the youngsters who are now educated and open to discuss, I find it very curious to know about preconception care. My daughter herself, she asked me, "Mom, I never knew that so much is there. You need to prepare so much before conception." I think it is much taken now positively. So let us talk about it. Who should talk? The pediatricians can talk. The gynecologists can talk. I think we should talk about this, and fail to plan is plan to fail. Let us tell this to the young adults. Preconception care actually empowers and prepares the couple to welcome the child, and it has a maximal impact on the short and long-term health of the couple and the baby, and of course the healthy society. So that is the beginning. So the need is there to develop preconception care concept, because you can see 4 out of 10, that is 40%, report pregnancies unplanned. Very, very pathetic. Mothers are still undernourished in India. There's a lot of iron deficiency anemia, increasing risk of mortality by almost 20%. And deaths around the birth are 50% higher among children born to mothers under the age of 20. That is, we do not want teenage pregnancies. So let us talk about the age of pregnancy also during the preconception care and the nutrition during preconception. I'm terming this period as fourth trimester, though it is happening before the child is born. So this is actually considered as a fourth trimester. It lays the foundation for a healthy pregnancy and the future well-being of the offspring. The nutritional status and the dietary habits of both the prospective parents are very, very significant. Just mind you, it is not just the mother or the prospective girl. It is the boy and the young adult boy. So he also has to take care. It actually affects the ability to conceive itself and influences the health and progression of the pregnancy and long-term health trajectory of the child. So it's like, preparing the soil for a seed to ensure strong and resilient growth. So we have to optimize the fertility in both the partners. For the woman, just see the hormonal. I'm talking beyond what we know, routinely talk. So the adequate intake of essential nutrients actually supports the hormonal balance in the woman or the young woman, young parent, about to be the prospective parent. It's important. The nutrition during this period is important for regular ovulation and healthy menstrual cycle. Deficiencies or excesses can disrupt these processes and impact the fertility. Egg health is also important. The quality of the egg is influenced by the mother's nutritional status. Can we mute others, Priya, please? The quality of the egg is influenced by the mother's nutritional status in the months leading up to ovulation. So the mother, when we ovulate, the 14 days before the ovulation, can we mute all others? So the impact of the nutrition, even on the egg quality, is noted. Nutrients like folate, B12, antioxidants, which includes vitamin C and E, and omega-3 fatty acids are thought to play a role in egg maturation and viability. Think beyond this. The egg maturation, the quality of the egg and viability is all depends on the nutrition at that period of time. Even the uterine health, a well-nourished body supports a healthy uterine environment, which will be conducive for implantation in the early stage of pregnancy. So nutrition has a play even at that primary level. And of course, both underweight and overweight, which is obesity, can actually negatively affect the ovulation and increase the risk of infertility. So it is important to have a proper body mass index. We do not want undernutrition or obesity. So nutrition again plays a role here. For the men, coming to the men, the sperm health, the quality, including the count, motility, morphology, the DNA integrity is influenced by the father's diet. Nutrients like zinc, selenium, vitamin C, vitamin E, and folate are vital for the healthy sperm production and function. So we need to talk about proper nutrition, which includes micronutrients, antioxidants to the boys or the young men before conception. Hormonal balance is also important because a balanced diet will actually support optimal testosterone levels and other hormones, which is essential for male fertility. Again, weight management also is important for women because it will, for men too, which will impair sperm quality and reduce fertility if you do not, especially when there's obesity. These are the other external factors which may cause infertility during the preconception period. So we need to take care of all these factors. Now, we need to set a stage for a healthy pregnancy. So we need to have good nutrient reserves. Then this is the ideal time when the woman should build, when we want to conceive, at least 4 months before we need to plan your pregnancy. So within that 4 months, we can have good reserves for nutrients, especially the folate, iron, calcium, and iodine. So this is important for the future pregnancy. And especially the folate, we all know that most of the time when they come to know they are pregnant, we already missed that crucial period of embryo neural tube formation. So the adequate folic acid should be taken well before you're planning pregnancy. And minimizing other pregnancy complications, the nutrition plays a role, especially gestational diabetes, preeclampsia, and preterm births. Then placental development, we know that placenta is the only organ which helps in nutrition to the fetus. So the early nutritional environment actually impacts the placental development. So we need to see that we have proper nutrition so that the baby gets, good placenta is formed, which is actually gives good nutrients and oxygen to the baby throughout pregnancy. Early organ development, we have this epigenetic programming. So this will also, this is important because early organ development also is based on the nutrients. The availability of proper essential nutrients from the mother's diet during this time is critical for orgogenesis. And brain development, again, I'm insisting on the brain because this is what makes us unique. Nutrients like choline, omega-3 fatty acids, and iron and folate are very crucial for the development of the fetal brain and nervous system. And when there's a metabolic programming is not proper, it can be lead to chronic disease like obesity, type 2, and cardiovascular later in life. So the epigenetic mechanisms are very important. The genetic expression actually, happens if they don't, when the alteration, the DNA sequence is not happening, but the expression can be modified. The parental diet can influence this expression. The epigenetic marks in germ cells, especially the sperm and the egg, during the early embryonic development. It also, the early nutrition has a big impact on the fetal immune system also, and influencing the risk for allergies and autoimmune diseases. This is what new studies are showing why this incidence of allergies are increasing, and autoimmune diseases, cancers. There is definitely a role for nutrition epigenetics. So we have to break this intergenerational cycle of disease. You can see the maternal diet has an impact, and how the maternal and paternal genetic background and other lifestyle and exposure to environmental factors can have epigenetic modification during developing, during the baby's fetal development, and later leading to lifestyle problems like obesity, metabolic syndrome, cardiovascular diseases, low birth weight, and even mental illness and diabetes. So we need to optimize the health and nutritional status of these prospective parents to prevent this intergenerational spread. And we need to break this cycle. So I would say I would end this preconception nutrition with a key recommendation saying that both the prospective parents should have a balanced and diverse diet, and which includes, of course, fruits, vegetables, whole grains, which has all the macro which I mentioned. Please focus on folic acid supplementation for all women of childbearing age, and at least 400 mics should be taken. Iron-rich foods important because we need to keep our reserves too. Iodine intake is important to support thyroid health. Omega-3 fatty acids, especially omega-3, particularly the DHA, is important in the diet and for the brain growth for the child. Maintaining healthy weight for both is important, and we have to avoid, of course, alcohol, smoking, caffeine, other drugs during this preconception period also. Now coming to maternal health. So after the mother conceives, adequate nutrition during pregnancy also is very important, as we spoke about preconception period also. So this we always said, this is a routine thing. We always speak about maternal nutrition and the impact that is well known. But preconception nutrition also has an impact which is not so well known. We need to propagate that. So mother has to cope up with the additional demands of pregnancy, especially the energy levels, and we have to reduce the complication like gestational diabetes and preeclampsia, and we have to prepare her for lactation and labor. So we need to do the nutritional epigenetic programming at this time, and again, as I said, the genetic expression on the offspring should not be affected. So it is macro and macronutrients. Macro, we know the proteins, carbohydrate, fats, all are important during the when the mother is pregnant. You know, to take care of a nutrition. What is the role of protein, carbohydrates, fats? We are well known, but I would insist on one thing: the carbohydrate should be more of complex carbohydrates, rich in fiber, which will give us sustained energy and help regulate blood sugar levels, which will actually prevent gestational diabetes and ensure a steady supply of glucose to the fetus. So this is very important. Even the fats what the mother is taking will be important for the brain development of the child. Like long chain polyunsaturated and DHA and arachidonic acid are very critical for the fetal brain and eye development.
Dr. Shivakumar, please mute yourself. Dr. Shivakumar. Venukutan.
Yeah. So adequate intake of essential fatty acids is important. Yeah. Can we mute Dr. Priya from your end?
Yeah, let me see now.
The host can mute.
Okay, madam.
Yeah, the host has the control, na? Yeah.
Yes.
So
yes,
yeah. So now coming to the micronutrients, which we often don't talk, we know about the carbohydrates, but as proteins and fats, but there's a difference. See, in the fats also, we are insisting on the fats which are important for the brain growth. When the brain is under construction. So what we require is DHAs and polyunsaturated fatty acids, arachidonic acid. These are critical for the fetal brain eye development also. Regarding carbohydrates, we have to ensure that it is again complex carbohydrates so that we don't give gestational diabetes. So likewise, we need to talk about the nature of this carbohydrate and fats also. Coming to micronutrients, folate, very, very important for cell division. We all know that, and DNA synthesis. Adequate intake is important even before conception, as we discussed earlier. And during the first trimester, definitely, which will reduce the risk of neural tube defects. Iron, important for formation of RBCs and carrying oxygen to the fetus. Therefore, the iron deficiency anemia during pregnancy can not only lead to maternal anemia, even may cause problem on the baby, leading to low birth weight and preterm births. Calcium, vital for the development of strong bones and teeth in the fetus. The mother's body will prioritize the baby's calcium needs, potentially depleting her own stores if intake is insufficient. The baby, we all know, like parasite takes in what it wants, but the mother can be depleted, so we need to give that sufficiently. Vitamin D works with calcium to support bone health, also plays a role in immune system. So deficiency can be linked to adverse pregnancy outcomes. So we need to ensure a proper appropriate vitamin D intake during pregnancy. Iodine, important for the brain development and neurological function in the fetus. So we have to ensure that the iodine is not deficient. It may lead to neurodevelopmental delays later. Zinc also, these are all the things which is important for the maternal nutrition. Zinc, ensure that she takes proper zinc in proper what is the appropriate doses, because zinc has a role in cell growth, immune function, and enzyme activity. Adequate intake is important for fetal development and also to prevent preterm births. Choline plays a crucial role in brain and spinal cord development and may have long-term benefits for cognition of the baby. Vitamin A, we know, for vision, immune function, and cell growth. Excessive intake can also be harmful, so moderation is the key. Vitamin C is an antioxidant which supports immune function and aids in iron absorption of all the B vitamins. It's involved in energy, metabolism, nerve function, and RBC formation, crucial for fetal growth. So we need to ensure all these micronutrients, folate, iron, calcium, vitamin D, zinc, choline, vitamin A, and vitamin C for the maternal nutrition. Now, it is important how all these things actually impact the organogenesis, cell differentiation. This is the recent updates that nutrients, when this actually will, they are actually when the formation of organs are happening and differentiation, cell differentiation is happening, it's important that all the micronutrients are available because they can cause impact at different stages of and it can be irreversible. Structural abnormalities can develop. And nutrients like DHA, choline, iron, folic are particularly vital for the brain cell formation, migration, differentiation, and myelination. So we need to give them in adequate quantities. And we also know about the impact on immune system and again, metabolic programming. Maternal nutrition can influence the fetus. How we know it can also lead to obesity and type 2 diabetes later in life for the baby by programming. When the environment is not proper, the epigenetic factors can lead to the problem to the baby. Placenta, appropriate nutrition is important for a good placenta. We have seen that earlier. Otherwise, it can lead to IUGR and low birth weight babies. So this is what I want to highlight, something new, the epigenetic inheritance, parental epigenetic inheritance. There are both sperm and egg cells. They carry this epigenetic information. And the parental diet can induce changes in the DNA methylation, histone modifications, and non-coding RNA content within these germ cells. So these alterations can be passed on to the offspring at conception. So did you ever think that even father's diet can impact the embryo? Actually the parental diet can induce these changes through these various methods, DNA methylation and RNA, all these things. So paternal epigenetic inheritance is what is now we are talking about, is a new area of research. Father's diet, lifestyle, way of conception can also alter the epigenetic marks in his sperm. These sperm-borne epigenetic signals can actually influence the embryonic development, and offspring can carry these patterns and leading to metabolic dysfunction later. Maternal epigenetic inheritance, not only paternal, even maternal nutrition, especially the nutrition, can directly influence the epigenetic programming through the placenta, affecting nutrient supply and hormonal signals, impacting the even testosterone, estrogen, and other hormones in the body. So it's a very critical period, especially when the gametes are being developed. The period of the sperm and egg maturation is the epigenetic modifications are happening because of the paternal diet. So both the father and the mother's diet is important because it is impacting the quality of the sperm and the ovum. And later on, when the child is born later, the lactation aspect also will come later how it impacts. So this is area of new area where I thought I should bring it to the table. The maternal malnutrition, there are studies how there's a malnutrition during early pregnancy can lead to altered DNA methylation, increasing the risk of obesity, cardiovascular disease, and schizophrenia, even mental health problem in adulthood. And maternal high-fat diet. There are studies, animal studies, to say that high-fat diet can induce epigenetic changes in the offspring, predisposing to obesity, insulin resistance. So that means we don't want obesity also can cause, affect the genes involved in metabolism and inflammation. Again, low protein diet, even that is not recommended. So appropriate proteins is important. So research has shown that if the mother is not taking proper proteins, if there's a protein restriction, it can lead to problems in the baby, including increased blood pressure through epigenetic mechanisms. Paternal obesity and high fat. There are studies to show that even the father's obesity can link to the altered sperm epigenetism and increased risk of metabolic disorders. Neurodevelopmental issues also, and even some cancers in offspring. Methyl donor nutrients. Maternal intake of methyl donors like folate, choline, B12, B vitamins is crucial for proper DNA methylation. So deficiency can lead to altered patterns and cause problems. So these are the few advanced new updates. So after talking about the new updates, coming to what already we know, maternal anemia is something which we cannot accept. And though it is very prevalent, we need to do urgently something about it. We know its impact. It can cause maternal death and also reduce iron transfer to the fetus, causing low birth weight, neonatal mortality, and impaired cognition, even the effect on the brain. So this is ultimately what we are recommending, the nutrient intake for the childbearing woman. Folic acid at least started 3 to 4 months before pregnancy, 400 micrograms per daily. Vitamin D, calcium, iron, and iodine. So this is what the appropriate RDA is for the childbearing age. So key recommendations, now ending with maternal nutrition, is we have to focus both on the father and the mother. For the mothers, because it is definitely we need to talk about the healthy diet for both, which will healthy parents and healthy baby. That is what we can talk to the parents. Taking balanced diet, having appropriate BMI, avoiding all the junk food, take proper water and micronutrients. Now coming after the child is born, this is about the maternal nutrition. Now after the child is born, the brain is still, not just before, I think even before the child's birth, the brain is formed in utero, but 25% brain growth is already happening in utero. Even after that, we have 75% still, the brain growth is still in our hands. That is pediatrician's hands. So we say, what can we do when we go into the labor room, even after when you're not having contact with the parents during preconception period or during pregnancy, if you do not have a contact, still after birth, you can still do something for the baby and for the parents. Because you can see this, 200 million children under 5 are not reaching their potential. Actually, the cognitive development is still below the average. 43% are actually not fulfilling their full potential as per the Lancet 2016 report. So we as pediatricians have a power, and I will include parents also. Let us empower them. Parents are the first pediatricians, I would say. So parents and pediatricians, we both have a power to see that at least we covered this 43%. So only we can do this. So let us do something about it and build healthier brains, healthier generation. So as I said, 25% brain is formed at birth, but 75% still we have in our hands. So we have to understand the brain development. I'm insisting on the brain because we are unique mammalians. Again, we need to be different from other mammalians. Brain is the most important asset for us to say that we are different from others. So we know that how the brain growth is happening. We have the brain growth is maximum during the first 2 to 3 years of life, and it is all under construction. So it has just come out as a mass, but the neurons are still not wired. So the synapses are still not happening. So even though we have 100 billion neurons at birth, the synapses are happening will continue to happen. So we need to talk about stimulation and proper nutrition even after birth or after for the brain growth. Anantaraj sir. So by the age of 2, I think we know about these pictures that the synapse formation and prunings are happening. So during this, why I'm showing this is not just about stimulation. Nutrition also has a role to play here. See, we can see this embryonic and fetal developments at a very cellular level. So we can all this can be impacted: mitosis, migration, differentiation, and then if we are not synapse, there be the myelination. All this is happening. So the nutrition can impact the brain development. So what are those nutrients which are actually impacting the brain? So these are the various neuronutrients. So it can impact the different parts of the brain. So we can see that the vision area, we want PUFAs, vitamin A, taurine, carnitine, thiamine, and it also, we want protein, zinc, folic acid, carnitine, and PUFAs for the frontal part. Iron, PUFAs, iodine, choline, all these things are important for cognition. And for the folic acid, B12, thiamine is also important at temporal for the speech and other things. So these are the how the micronutrients can impact the neural development. So the DHA, even for the eye, we want 60% DHA. It is all made of 60% DHA. So for the visual acuity, also we want proper nutrition. The brain itself, 40% is made of DHAs. We want DHAs there. So proper vision, hearing, cognition, speech, memory, social development, and behavior, all is depending on proper nutrition during this first 1,000 days when the brain is under construction. So all the below foods we want them to take. The baby should be taking leafy vegetables, walnuts, beans, mustard oil, raspberry oil, fish, etc. So, but in the beginning, it's only human milk. We all know that. So when the child is born, it has all these factors. All what we want is there. This is a gold standard. It remains as a gold standard. The composition, we spoke generally about only proteins, fats, when we talk about UGs and PGs. Let us also talk to them right from the beginning about even the microbiome, how it impacts the immune system, how it is, the lipids are important for the brain growth, and the bioactive material like oligosaccharides, lactoferrin, the immunoglobulins, cytokines, chemokines, all these are very important for the not just for the growth and development, for the immunity, maturation, etc. Key factors also should be told. We can show this picture actually to the parents and show them how it is important to prevent non-communicable diseases, infectious diseases, apart from ensuring proper growth and development. So we need to talk about the feeding. So how breastfeeding, we know about that breast milk is good, but somehow we are still lagging. So implementation, the key. Let us talk. I think we are not, we have to look at new methods, how we can attract the parents to talk about breast milk, maybe talk about their intelligence. Maybe we can talk that will be beautiful. They'll be more smarter, because smarter is what will, maybe it's appealing for the young generation. Now we are going to see beta generation. After 2025, all the children who are born are called beta generation. They are going to be living in artificial intelligence, era of artificial intelligence. So I think they should be smarter. So all this nutrition is important for them. So let us talk something differently. Somehow what all we are talking till now has not caught up. We have to look at new slogans, new methods to improve, and new policies, interventions to see that our breastfeeding is 100%. So if we talk about immunity, cancer prevention, obesity prevention, NCD prevention, these are some new things we can talk to them. IQ level and smartness. This is what I think we should propagate and talk about this. This is something new, not very new. Already we have some evidence that gut microbiome is very, very important. This is an area of research still happening. Studies are showing how factors like vaginal delivery versus C-section are impacting the microbiome in the gut of the baby. Early feeding versus formula. So we want, and how this is impacting the microbiome. Introduction of complementary foods also can shape the microbiome. So what the baby is taking in actually will help in which good bacteria is being established in the baby's gut. The role of the human milk oligosaccharides and probiotics and the other synbiotics is also important for good gut health, immune function and metabolic health. This is a very hot topic now of research. I am also started a recent, project on this. Very, very exciting to see that the gut-brain axis is now, it is interrelated. What we are, gut and brain, how the early nutrition can impact this on the neurodevelopment and behavior also has to be studied. Also, then the nutrition versus allergy prevention. We have to understand this. So understanding how early nutrition can influence allergy development. This is an emerging, again, area of research. Research is exploring the role of gut microbiome and early introduction of allergenic foods in preventing conditions like eczema, food allergies, hair, and asthma. Maternal diet during pregnancy and breastfeeding also has an impact on, on the allergy. This is also being investigated. So these are the new areas when nutrition and allergy. Nutrition and cognition, again, new area for research. This is what will attract, this is what the brain is something we need to preserve it, in fact, enhance it. And we're going to use more of brain than, other parts of the body. So research is focusing more on these essential nutrients like polyunsaturated fatty acids, DHAs, including iron, zinc, folate, and choline. The impact on these, the various micronutrients on cognition, neurodevelopment outcomes. This area of research. Studies are also exploring how early nutrition imbalances can affect not the baby's nutrition and growth and also the behavior, learning, and mental health later in life. So you can see this picture, the nutrition and developing brain. So better school performance, language development, behavioral issues, then fine motor issues, wiring of the brain, and higher IQs, all are related to the proper nutrition. So why don't we talk about this than just saying that have proper food to the parents. Let us talk about better school performance, higher IQs, language development, and these other motor delays will not happen. So this is what we can talk. Maybe something new we need to talk about it. So again, I just want to talk a little bit about future research, how the maternal nutrition preconception, during the preconception period, pregnant lactation, and this is being studied. These are few of them. And maternal dietary patterns versus impact on the child's, of the long-term impact on the child. And epigenetic programming is also being studied. And then innovations in sourcing essential nutrients, especially on algal-based omega-3 and stabilized vitamins are also, the studies are now emerging. And these are a few things I wanted to mention. Now coming to, we having seen that breastfeeding, we don't have a choice. It is a must. It is mandatory. It's the best gift a mother can give to a baby, and which will last a lifetime, not only for this life, maybe for the next few generations too. So we don't have a choice. It, in fact, is a responsibility for all of us. So let us come back to the interventions. So having seen that, how it is impacting the child's growth development and impacting on the immunity, on the epigenetic, other programming of the another 2-3 generations, let us focus again on seeing that we increase breastfeeding rates in India for our babies. So again, we need to do all this, crawl immediately at the time of delivery, see that the baby is attached, ensure early and exclusive breastfeeding, and during the, what we need to do to the parents. I think we talk more, but I think we should be, practical help should be given to the mothers. We should create some counselors, some people who are passionate, and this comes out of passion. Many people cannot do that if you don't have the passion. You need to spend time with the mother to make her calm, relax, and talk about responsive feeding, proper attachment positioning, and what are the cues. And we need to talk to the mothers. Even the educated mothers may have a problem. Let's not assume that only few. It can happen across any generation, across all the countries. So we need to talk about all this and spend more time. That enough milk, a problem is not there. It is, in fact, the baby's stomach is very small. The God has made it. The nature has given the appropriate, secretion during the, as the baby increases, the stomach size increases and more milk comes. So don't worry. The baby's crying is not only for milk, maybe only for skin contact, maybe for He requires you to just hold on. So we need to talk and counsel, to show these pictures, to talk about how you can just relax, and all the hormones will release. I always tell whenever I go to the postnatal rounds, the buffaloes and cows never had a problem because they used to, and they enjoy at the spinal level. But we are thinking too much from the brain and so many doubts, and we don't have confidence on ourselves. So let us be de-stressing. Let us enjoy the nipple sensation at the when the baby is suckling. Only the woman knows how beautiful it is. So we have to talk about enjoy your motherhood, and it is about the feelings. We need to really make them feel that they should enjoy that this period, and all the breastfeeding problems can settle down if you just counsel them properly. And of course, we know that emptying is important. So positioning is what we need to see and cross-check whether it is proper. Talk about hind milk and the other fore milk also, and how we need to tell the mother, yes, you can know that your baby is having enough milk if the child is sleeping well, passing, all these things we need to reassure the mother. And we need to see that it is not interfered, the breastfeeding is not interfered by any other mechanism. So dads also can help by spending more time with the mother. In fact, he's just beside his wife can also give her solace, and he can do small things like this and participate in breastfeeding. Yeah, and then complementary feeding, we all know why it has to be initiated, when it has to be initiated. Only thing is we need to see that the parents are convinced that they have to initiate on time, because we want to show them the energy gap they're having if they depend only on breast milk. And these are the 4 pillars. It should be timely, adequate, appropriate, and safe. So we need to show this, the guiding principles to the parents. So practicing early exclusive breastfeeding is important, and starting complementary feeding at 6 months is also very important, and how it should be, and it should be given, and the breastfeeding should be given night feeds, all that we all know this, and how the responsive feeding should be taking place, because this is again where is lacking actually nowadays. So we all know that is important, but somehow not happening. The feeding is not responsive. Their cell phones, mobile phones are coming in. The mother is struggling, the parents are struggling to feed, and somehow we have to go back to our old days where responsive feeding was happening. And what we can do, distraction should be minimum. The baby and the parent should be, of course, it should be supervised. Don't leave the baby, and we have to supervise this feeding and actually appreciate them whenever they take, and always that they are looking at you. If you appreciate, they'll like it, and they will again repeat the same behavior. Encourage finger foods, all that we know, and safety, hygiene is important. So, and this is what we already know. So I'm just going a little faster on this. The different stages when we need to be mashed and then give coarse foods, and how much to give, how to give, what is the right consistency. All this has to be told to the parents. So this is nutritional counseling to the parents. We talk about iron deficiency also, and when to supplement the iron, and what are the various, we all know Madam Elizabeth says rainbow colors. So all this we need to talk about different food types, and including egg is now come out as a very important group of food. So we need to talk about the different food groups. At 6 months, how much to give, what to give, and avoid all this junk food, especially the fried foods from outside. How to introduce and give the different food, complementary foods. Talk about amylase powder. This is something new. Many people may not know, and we need to tell them don't drain the water, and even the whey protein can be used. So these are some commandments for the exclusive, for the complementary fooding, and for the then little bit on picky eaters. So when the children are becoming very picky, the parents have a hell of a problem. My child is not eating this. He never takes this food. So what to do about this? So they usually refer
Priya.
Sir,
You may call
out madam.
the
Log out ആയി.
ഒന്ന് വിളിച്ചു നോക്കിയോ?
വിളിക്കാം. Madam will join in a while.
Okay.
Yeah. Like, hello.
Yes, madam. Yes.
Yeah. So I was just at the end of my presentation. There was a sudden power breakdown here. So I just talking about the whole phase from preconception to maternal nutrition and the care of the nutrition for the baby after birth, including breastfeeding and complementary feeding. So I would like to leave with a key message saying for a healthy beginning and healthy future, we have seen research and new updates have shown the importance of macronutrients, micronutrients, microbiota, the gut microbiome, and the gut-brain axis, epigenetics, and genetic expression. So keeping all this in mind, we need to really focus not just on maternal nutrition and the baby after is born. Let us also focus on the preconception period. The preconception care nutrition is also extremely important, as we have seen that the father's diet, the mother's diet has a huge impact on the baby before we conceive. So that is preparing the womb, preparing like a soil, as we said, the seed is sown. So we need to prepare well. We need to ensure that both have proper micronutrients, and we have to see that they are not deficient. Anemia and other things should be tackled. Maternal nutrition is also equally important after the conception happens, because that time the brain is being developed, and whenever there's any problem with the micro and micronutrients in the mother, there can be a huge impact to the baby. We have seen that when it can also have long-term consequences like metabolic disorders or long-term NCDs, non-communicable disorders. And the 1,000 days nutrition for the baby is extremely important. Exclusive breastfeeding and appropriate complement feeding is the key. And we have to ensure that the child is having somehow take the breast milk. Breast milk is the gold standard. We do not have any substitute for that. So it has everything what we want. So we need to really focus more on implementation. We know the gaps, but we have to think about innovative methods, how we can cover the gap, that we want to have exclusive 100% breastfeeding for our children. Again, I'm telling this focusing on the brain of the baby. And I would end with saying, let us all come together, pediatricians and IAPNs, all come together to focus on implementation strategies to work on preconception care and the 1,000 days of nutrition. Thank you so much for giving me an opportunity, Dr. Priya. I'm sorry that at the end I could just join through mobile. Thank you so much. I hope I could stimulate a little bit on the recent developments.
Yes, madam. Yes, it was a very, very enlightening talk, and especially on the nutrition of boys. We were not thinking about boys, but now the nutrition of boys has also become very important. Purushothaman sir, a few comments.
Excellent talk, madam. And just like Priya mentioned, the importance of the diet of the boys. And one more thing is avoiding the alcohol and other things for the male if they are planning for the pregnancy.
Yes, sir. Not even a drop of alcohol is allowed or recommended during the preconception period.
Another thing regarding it's a controversial thing. So we all IAP also recommends vitamin D since birth, and I am firmly believe exclusive breastfeeding up to 6 months should be reinstated And vitamin D deficiency in the newborn babies were considered as a reason for supplementation, just like the developed countries. But if the mother is not deficient, ensuring the diet of the mothers from the early pregnancy till the end of this, and if the babies are having adequate weight above maybe 3 kg and term, why not we go for exclusive breastfeeding, avoid the supplementation of vitamin D? It's not for a low birth weight or a preterm baby, definitely there's a need for supplementation. For a baby who is born at term, is having adequate weight, exclusively breastfed, why should there be another supplementation? That is against exclusive breastfeeding concept which we are teaching all these years. Now, why should we go back?
Actually, when I was, I think, I remember when I 30 years back, I was still in medical undergraduate. That time, it was not there in the prescriptions. As you said, slowly, a lot of studies have happened, and then they said, let us supplement vitamin D even for a normal baby. So that is the only micronutrient which is allowed to be supplemented, and it is based on evidence, sir. I think as the new areas of research still tells to negate it, we require more studies. But right now, it is being recommended based on the studies the neonatologists, even NNF and IAP both recommend the vitamin D supplementation.
That's against the nature. In nature, what we say is that all animals are equipped with whatever is needed for its own baby. So, provided the
again,
mother is sufficient, ensure the mother's sufficiency of the vitamin D,
vitamin D.
exclusive breastfeeding. That is the only thing natural. The other things, whatever evidence can go wrong.
So, thank you. So we are actually questioning the guidelines, but then the guidelines come only after proper, robust, evidence is seen by committees. So right now, I'm not able to contradict that, but you are right that maybe exclude it was natural, but then a lot of studies have shown we need it. So we need to undo that again. We need to have robust evidence. That is what I'm saying, but I feel it's natural and it should be sufficient, as you said. Yeah, why only the vitamin D? All others are okay. All other components are okay. Yeah.
Thank you very much, sir. Any other comments? Srinivasan, sir?
Yeah, vitamin D, of course, is recommended, and we have seen so many children getting exclusive breastfeeding having deficiency in spite of mother having adequate vitamin D levels. So I think there is exactly what is the mechanism I cannot say, but it is to be recommended till, of course, new evidence comes or Purushottam brings in more listening evidence. So exclusive breastfeeding, we are talking about only what we are giving during this thing, but this is a drug which is recommended. So I think, of course, Elizabeth will be the best person because I
And
am
Elizabeth,
not.
ma'am.
I didn't want a diploma course in nutrition, and whereas she has done this thing degree course on nutrition.
Madam is
Madam
there?
has, has a talk, another talk at 8:30 p.m. So
Okay, right.
yes,
Mm.
yes.
Yeah.
So I think our duty is to make our mothers vitamin D sufficient.
Sufficient. Yeah.
Even
And
otherwise, the transfer of this thing, the breast milk is inadequate. That's what I have read. But anyhow,
yes, sir.
that is
In
why they are
spite of
recommending.
supplementing, in spite of
Yeah.
supplementing to the mother, still they found it was deficient, therefore it was recommended. So it is actually a long type of, it has not come overnight. There were many committees and many discussions happened, and then it came into the guidelines. So right now we are not, we cannot, no. Right now we need to follow it. That's what I can say. That's all.
No, I
Yeah.
think when it comes to vitamin D and calcium metabolism and all, along with this nutrition, exercise also plays an important role. So as Madam has already told, our prospective dads and moms should get adequate exercise. So that is also equally important.
Actually, I focused only on nutrition here, but in the whole preconception care package. So we have other things also, mental support, and then of course exercise, physical activity, your genetic mapping. Look at what genes you're carrying and try to prevent the transmission to the next generation, because that's the only way we can stop this so many things here. We don't have any treatment as yet. So still, instead of seeing only kundalis while we marry, so we have to look at I think the genetic history and also the non-NCDs in the family and take proper steps at least to reduce the transmission. This awareness we need to give to the prospective parents. It is a very, now the society is becoming bolder, and there are many educated boys and girls are marrying little later also. So they are open for discussion and they want proper planning. And therefore we can tell there's a scope for us to open preconception clinics also in the future. So maybe after 10 years or 5 years, I would love to see PCC clinics being developed in our country, where proper planning is happening, proper preparation is happening, because we are only planning 1 or 2 kids. So why not the best? So this is the idea. And we should think about the next best generation who's very smart, whose brain is well developed. And they should focus on not just stimulation and nutrition, both have a play for proper brain growth for the child.
Thank you, madam. Thank you very much. There are no more comments. Vinikutan, can you please give a vote of thanks?
Actually, one of our here one yoga teacher in one school. Can you hear me, ma'am?
Yeah.
Yes. I think we need to give.
One yoga teacher in school recommended magnesium tablets for all the 10th and 9th students. I never heard about that. What is your comments? Any role for magnesium, ma'am?
Magnesium.
More and more micronutrients.
So magnesium is actually a micronutrient basically for I think inducing sleep and other things. But then for young people,
Yeah,
is it for
actually
young?
what yoga teacher recommended. Yoga teacher and
yeah, this yoga people
teacher.
now they are actually recommending for sleep, or calming down the brain and inducing sleep. After they usually recommend in the evening, 4 o'clock, 5 o'clock, you take one tablet, and by 9 o'clock you should sleep. So the sleep, you all know now we are focusing again on sleep. Sleep is actually it's anti-inflammatory, and it actually it's an antioxidant. It repairs your body. It repairs your brain. So to induce that, magnesium is given, and
my
yoga
sister is
people
in
are now
IT
using
field,
it.
and she was telling in Bangalore, most of the IT persons take it, magnesium tablets. I don't know.
Once something
They said
clicks
it's
with the IT
good
people,
for
they
the
make it a fashion statement.
maybe.
Yeah. So instead of that, we can actually work hard and sleep at 9, 10 o'clock. That's what they say. And 10 to 11, 12, 2 o'clock, that is the best time that sleep actually heals you. But then we are in so many webinars till 11, 12 o'clock, and we are ourselves on the screen for a long time. And we really have to balance this. The old days, 6 o'clock, the lights, there was no electricity. People used to sleep at 9, 8 o'clock, 9 o'clock. And they had good life, they had 100 years they used to live. So I think we have to go back to this age-old thing. Lot of healing was there, lot of calming was there. Is to work hard, proper nutrition, lifestyle diseases were not there. We never heard of cancers, obesity, cardiovascular problems those days. And we need to go back and rethink of what we are doing. Yes, sir. Jalil, sir, you are about to say something.
Since magnesium Vinikutan sir is asked, is the oral preparation. I have a complicated SAM in the ward, where I just incidental finding of 1.5. Is there oral magnesium form available for infant therapy base?
Yes, sir. Tablets are also available. It is a magnesium glycinate, 500 milligrams is available, sir. Oral formulations are available.
Available. What is the trade name?
I'll just WhatsApp you, sir. But magnesium glycinate is being used. Yeah.
So there is one preparation called McAlvit. McAlvit, I think, by Mayer.
McAlvit syrup, madam.
Yes.
That also has calcium.
Check the dose and all. We need to look into the dose. What we usually do is the ampule. We give for 14 days the ampule preparation itself, which we give like IM magnesium, which we give for eclampsia and all. That ampule itself, we give it orally. for 14 days.
We used to give for the Caesars something pre-eclampsia for the maternal side. And regarding this, is this has got any prognostic significance, madam? The low magnesium in a SAM baby.
No, actually, magnesium is important, sir, for like any other micronutrient. So supplementation is given. All micronutrients are given. So it has effect on the neurons, and therefore it is recommended that all the micronutrients should be supplemented, especially it is deficient in SAMs, and therefore we need to supplement it.
There is a preparation. I forgot the name. We were having a Gentleman syndrome. So it's not only in SAM. SAM you'll be giving for a short period. There are renal tubular disorders where the magnesium is too low. You need to continue it for a long time, high doses. There was a preparation we are giving for the Gentleman syndrome. It's available. My point about the magnesium, there's a video going around. There are people who are not experts, actually claim to be experts in nutrition, are making all these controversies. So it is projected. Many of the nutrients actually are projected as so essential. And one more point, madam, is the boys now going for the gymnasium and exercise, they are consuming many items which we are not aware. Not much, especially creatine and many other products they are taking for during the exercise. So what will be the influence of all these dietary preparations in the
So during the
parent?
during the preconception period, we do not recommend all those supplements, sir. They may have steroids and other things, even metals. So we recommend only the proper nutrition, proper quality proteins and fats. When we say PUFAs and the essential fats, which has DHAs, etc., micro antioxidants also to improve the quality of your sperm. So those type of proper, the gym supplements was not recommended at all.
Included in the advice, madam. The preconceptional boys diet pattern, you should be avoiding unnecessary preparations, especially those who are going for the gymnasium.
Yeah, actually for the boys, sir, I also recommend that they should actually the sperm quality never focus. Usually the girls are being focused more. For the boys, they have to actually take care of the smoking, alcohol, as we already discussed, and also the pesticide pollution, the exposure to radiation, and this may cause the low sperm count and the quality also maybe not be good. So we need to talk to them. Even mobile exposure, mobile phones they usually keep on their pants, in which is at the lower area. So they may be exposed to all this radiation. So this is not recommended. We need to tell them to keep the cell phones away. And when they're sleeping, we usually keep very close near the pillows. And these are the few things. We don't know the long-term effects. So the studies have shown that these radiations can cause problem. So we need to switch off and keep them away, and at least as much as possible. But we cannot avoid the cell phones and digital nowadays. So we have to live with it, but also know how to be careful, and we need not take so much of load of radiation.
Ma'am, Professor Srinivasan wants to tell.
Yes,
Yeah,
sir.
can I make a comment?
Madam,
Yes, sir. Yes.
Yeah, can I make a comment? Yeah, we are talking about so many things about nutrition, but what I find annoying is, all the children in whether in airport or bus stand or railway stations or in the OPDs, they are coming in jeans. They are having this thing, This is a very
Yes,
bad
sir.
culture for especially
Yes,
with regard to vitamin D and sperm generation.
Yes, sir.
Many people now they have, sterility because of this thing,
Infertilities.
inadequate number of sperms and abnormal
Yes,
sperms. I think this culture we should try to.
Yes, sir. We need to talk about clothing and tight clothing, and
Yeah.
especially the
Yeah,
yes, sir.
of course, it's
Absolutely,
not
sir.
concerned with nutrition, but vitamin D is totally. I see in America we are walking, even in winter they are walking in half pants, etc. In spite of winter. But here in India, in the beach, Pondicherry beach, everybody comes with children with this thing, jeans. I stop them and talk to them. Please, you are supposed to expose the child to sunlight. Yeah. I think that is another part of
Dr.
nutrition.
Nandini is, Dr. Nandini.
Good evening, madam. With your permission, Dr. Nandini Kumaran from Coimbatore.
Madam, good
Excellent,
evening. Nice
excellent
to
talk.
thank
Excellent
you
talk,
for your
madam.
presence.
Excellent talk, madam. We really enjoyed. Just regarding the magnesium, what Dr. Jalil was asking. There's a preparation called Catchnil, CATCHNIL. The adult physicians use it for cramps. They're prescribed for cramps, like muscle cramps, etc. It contains 800 milligrams of magnesium and 1000 unit of vitamin D, along with the vitamin E also. So that's one preparation Dr. Jalil was asking for magnesium. So that is a thing called Catchnil, magnesium, vitamin D, and E. Thank you, madam. Thanks for the opportunity.
Thank you for that input, madam. Different nutrition preparations, yeah. Thank you. You're muted, Priya. Unmute.
Priya, you are muted. Unmute, Priya. You are muted. We can't hear you.
आज कितने बुक बेचे तूने? हैं? कितने बुक बेचे तूने?
Can you give a order?
Hello, ma'am.
Binikutan, can you hear me?
Yes, ma'am. Yeah, definitely. Thank you, Priya madam, for this opportunity. And that is an excellent class, Himabindu madam. And we are all grateful for your talk. That was very useful. And Jalil sir also, thank you, sir. Thank you for the discussion. And Srinivasan sir, Purushothaman sir, all the seniors. Actually, we had a very good crowd, actually, and not more than that number. We had a very good audience, which actively participated in the discussion. And thank you once again for this excellent talk, ma'am. We expect more from this nutrition chapter. Thank you, ma'am.
Thank you so much, Binu. Thank you.
Excellent.
Thank you so much, Priya.
Thank
Thank you so much, all of you. Thank you, Jalil sir,
Excellent, madam.
Srinivasan
Hima
sir.
madam,
Thank
excellent.
you.
Good.
Thank you,
Yeah, very
thank you,
good talk.
Jalil sir. Thank you. Thank you so much.
Thank you, madam. Thank you.
Thank you.
Good night, all of
Good
you.
night. Good night.
Have a
Good
great
night.
day.